Hello everyone, welcome you all in today's lecture. The lecture is promoting self-care and emotional resilience. So in this lecture, the main objective will be to learn about what is self-care, then emotional resilience, why does emotional resilience and self-care matters, and what are the techniques can be used to enhance self-care, what are the cultural and the gender consideration that we can read in this lecture, and then we will talk about some good values or good things that can be amplified in our life. So this is our learning outcome. Starting with self care, so in general, we whenever we talk about self care, we see it as in a general purview of uh, general health or physical appearance, but it has many more meaning that we don't know about it. So according to definition of WHO, the self care is the ability of individual, families, communities to promote health, prevent disease, maintain health, cope with illness and disability, or with or without the support of health workers. So here when we see this self care, then self care is actually it is a contribution of many other sources or factors, like there are healthcare also, there are communities also, and we as a self get involved in this cycle. So it is an general overview. Currently 3.6 billion people lack access to essential health services. This is, we are talking about the worldwide perspective. So self care intervention are evidence based quality tool. They include medicine, counseling, diagnostic or digital technologies which can be assessed or partially outside formal services. So as we talked, that self care is not bounded up to the self, it is the whole consideration of community, family other than self. Now talking about the emotional resilience. So emotional resilience is the bouncing back from any kind of adverse situations, like any kind of mishappenings or any situation in which the person faces the challenges. So here if we talk about the definition, then it is the process and outcome of successfully adapting to difficult or challenging life experiences, especially through mental, emotional, behavioral flexibility and adjustment to the external or internal demands. And there are number of factors that contribute to the emotional resilience, like the way in which individual view and engage with the world. Another is the availability and the quality of social resources that the person is getting, or the specific coping strategies that the person is using to bounce back from the situation or in his day to day life. So emotional resilience is very important when we are talking about the self care. So it is one of the factor which is happening through the learning processes, learning from the experiences or the previous experiences, so that we can deal it the next upcoming challenges of similar kind in an effective way. Now we are talking about why resilience and self care matters. So first is resilience. Like resilience, it improves mental health. So people are away from depression, anxiety and many more such kind of psychological issues when they are resilient, when they know how to learn or how to bounce back from the situation, how to deal with situation effectively. Then second is the boosting problem solving skills. So emotional resilience also helps the person to understand the or identify problem and solve it in a better way, as the previous way was not that much effective or the previous way was effective. So with that they learn how to solve a problem in a new and better way. Third is strengthening the relationship. So during the resilience process, person learn how to build up relationship, how to connect with the social environment to resolve the problem or to get out from that problematic issue. So this is how the resilience help in building or strengthening the relationship. Then fourth is enhancing the performance. So it is very common that when you are resilient, you are keeping yourself motivated and you deal with problems much more effective way, and with that you get motivated and you are motivated to solve such problem in future as well. When talking about self care, so self care prevents from burnout. So if we are taking care of self, not only our physical appearance, as we talked about the definition of self care previously. So it is not only the self care that is related to the physical appearance or physical health. So it is more towards the community, more towards the social environment, and more toward other aspect of our life. So if we are doing or taking care of those aspects in a better way, then we are preventing ourselves from getting burnout. We are practicing many new things which are evidence based, such as relaxation practices and many more other services that are given by the health workers. So these things help us or prevent us from getting burnout in educational setup or in any workplace. Second is improves emotional regulation. So when we are taking care of ourselves, or when we are doing a proper self care work or applying proper self care strategies, then we are able to deal with the problem effectively, and that helps us to regulate our emotion in a better way. Then promoting physical health, as we talked that physical health, we will discuss later how the physical health is important in maintaining our mental health as well as social health. So self care actually promotes the physical health, which is very important part, and generally we focus on this single aspect. So we will discuss it how other aspect can also be seen or taken in this. Then fourth is strengthening self worth. This self care, when we are well resilient, when we are equipped with many good strategies, techniques to take care of ourselves or to cope with the situation in a better way, then this promotes our self worth and this promotes our confidence. So this is how the self care is directly in contact or in touch with the promotion of self worth or self care. Now let us discuss about types of self care. So in this there are 5 types of self care that I have shown here. First is physical, second is emotional, then social, mental and spiritual. So in these domain we can work to see self care as a overall view. If you talk about the physical, then sleep, nutrition, exercises, these comes under this. If we talk about the emotional, then emotional regulation, boundaries that we are maintaining, these are coming in this under this domain. Then in social, how we are connecting with other in community, in society. Then mental, how we are taking our self care by practicing mindfulness, learning new things with the experiences. And spiritual, how we are practicing values and reflection. So we will discuss it is in more detail in upcoming slides. So let us start with the physical self care strategies. In this, on your right side you are able to see the diagram that I have shown. In this, it is the biopsychosocial model of health, in which you can see the biological domain, and then you can see the psychological domain, and you can see the social domain. And these all domain are interrelated to each other, and these are related and form a mental health. So this is how we need to understand the self care and resilience, how they are working in a loop. So biological, like physical health, genetic vulnerability, temperament, and then psychological, if we see the self esteem, temperament, coping skills, and social skills, family relationship. In social domain we can see the family circumstances, school, peer, drug effect, and family relation and trauma. So these all things are interconnected to each other. If one domain is affected, for example, if there is any issues in biological area or biological domain, so it is directly going to impact the psychological domain of the individual's persona, and that is going to affect the social domain. So these are interrelated to bidirectional relationship is there between all these 3 domains of human life. For example, if there is any kind of physical health issue in any individual, So it is going to affect the self-esteem, it is going to affect the mood, it is going to affect the way he or she is taking or dealing with the situation. And this kind of situation or psychological aspect, this is going to affect the social domain, in which he or she will face difficulty in interacting with family and adapting with the peers. So all kind of negative emotion, negative expression will be there in this cycle. So when we are talking about the strategies, then regular exercise coming here. In regular exercise, we need to devote some of our time so that we can maintain our physical health or biological factor. For example, there are many hormones, many neurochemicals that are very essential to be regulated to maintain our mental health or mood, such as serotonin, dopamine. All these kind of hormones or neurotransmitters are essential for an individual. So regular exercise will help to reduce the stress, to get yourself relaxed. And then balanced nutrition, this is also very important. When you are taking a proper diet, when you are taking a proper nutrition, that is essential for your mental well-being or brain related functioning. So balanced nutrition is important. And adequate sleep. Most of the time psychologists talk about the sleep, because sleep is actually the important factor in many kind of mental health related issues, and it is the primary cause to as an onset of any kind of issues. For example, depression, bipolar affective disorder, mania, and many other problems that are directly associated with sleep. If there is any sleep disturbances or sleep cycle issue, then the probability of getting such kind of issues or illnesses is more. So adequate sleep, regular exercise, and balanced nutrition, these are the very common thing that can be used for as a physical self-care strategy. Next, we are talking about the emotional self-care strategy. So you are seeing on the right that the diagram is showing the thought, the behavior, and the emotion. And these are also, you can see the bidirectional arrow. These all are interrelated to each other. So in a similar way, the thought is going to affect your behavior, and your behavior is going to affect your emotion. Then again, your emotion can affect your thought, and these can affect any way. Thought can affect emotion, behavior. So this is the cycle, or this is the, we can say, the vicious cycle that will be or that can be maintained whenever any problem is there or any individual is facing any kind of problem. So to keep yourself emotionally well, you can practice such some exercises like journaling thought and feelings. The first one. So journaling thought and feeling means you're writing or jotting down your own thoughts, your own emotions, and getting reflected or getting a self reflection to that in a particular thought. So this will help you to analyze it, to understand it, its rationality and irrationality, and you can manage it well via practicing some cognitive strategies or any sort of strategies that you can get through. Second is practicing self compassion. So self compassion is very important, like kindness toward your own self, self acceptance. That is very important to keep yourself well or yourself stable. It is the most common thing that we must practice, because there are many things we will see in our society with different kind of people. Some people will be much better than us, some people will be much lower than us. So getting self comparison with other and to maintain yourself as mentally well, the self compassion is important here. Then third thing is therapy and counseling. So whenever you are facing that, the strategies you are using and the strength that you are having is not working to resolve that issues, so you can proceed further and you can seek for the help from any mental health professional that is available nearest to you. Now we are talking about the social self-care strategies. So in this, we talk about the maintaining healthy relationship, then seeking support when needed, and then setting boundaries. So as previously also in many lectures we have talked about the maintaining healthy relationship. Why maintaining healthy relationship important? Because this is also one of the factor in your self care, in building your self resilience, in your problem solving skills. So all these things, social equipments are very important, and this healthy relationship will help you to cope in any problems whenever you are getting through. Seeking support when needed. There are many people who does not try to get involved with therapies or get through any kind of assessment or help related to counseling. So for them, seeking support is important, because if until now you are not able to deal with your problem, so in future it may be possibility that you will be continuing with the similar problem, and the problem may worsen with time. So taking help of professional in a given time period in a correct time is important. Third is very important, that is setting boundaries, which most of the time we usually get disturbed in this domain. So setting boundary is basically, we will talk about three things: rigid boundary, diffuse boundary, and clear boundary. So usually in family, in any kind of relationship, we can see majorly these three boundaries. A rigid boundary is too strict kind of boundary, in which the people cannot get involved and in that particular domain or in that particular circle of family. For example, a father is too strict that other children are not able to converse with him, or they are not able to discuss their problem with him, and he this strictness is affecting the whole family environment. Or this rigid boundary can be with anyone or in any relationship. Diffuse boundary is too loose, like in a family domain, if other person are getting involved by diffusing, other person are taking interest in your decision making things in your family domain. So this is how a boundary is getting diffused. So for example, this is a boundary and your family domain. So in this, whatever rigid boundary is, there is no one able to impermeate through this boundary. Diffuse boundary is very extreme flexibility is there, so other person are getting involved in your personal matters or in your family matters. And third is clear boundary. The clear boundary is very flexible boundary, in which the decision making processes, everything is discussed in a better way. The child is easily able to deal or is easily able to get through his parent with his or her own difficulty and discuss with them, and the parents are easily able to let their perspective know the child in a better way, and they can together get into some kind of good answers or good outcome. So this is a clear boundary that is needed in the family. Then we will talk about some mental self-care strategies. So mental self-care strategies such as mindfulness and meditation, these strategies help you to get intact or get in touch with your surrounding or get self-aware, so that you can know how you are feeling, what you are feeling, what are the changes that is happening inside you, and you can control in that in a better way. Then engaging in hobbies. There are certain hobbies that you practice and you love to do it. It can be pleasurable activity. So hobbies are very important. There are in an educational setup, if we talk, then due to burden or academic stress or due to heavy academic workload, the people, they get away from their hobbies and they stop practicing their hobbies. So this is one of the lapse that generally happens, and engaging in hobbies will help you to maintain your self care in a better way. Then avoiding overconsumption of media. Today, nowadays, most of the population, student population or adult or youth, they are engaged in using the phone, mobile phone or internet in a very excessive amount. So this is how it will impact the mental domain or mental health of the individual. we can practice some strategies. I will explain two basic strategies. Like one is digital detoxification. In this, practicing time out from using electronic device either completely or for a specific subset of time. So you need to get yourself away from the media, smartphone for at least for few minutes, for a bit period of time, so that you can get intact or get in touch with your natural surrounding. Another thing is digital hygiene skill. There are some skills that you can basically practice in your family, in your home, or with you, so that you can get away from the digital equipments at least for a few minutes or few hours. Like you can put the phone basket, you can practice the silent notification, you can practice the staggered response, no phone zone, and status creation. So all these strategies can help you. For example, the phone basket, how you are going to practice. So in a family, there is one rule that at a point of time, a person or every family members will be keeping their phone away from them and in a basket. And later on, up to the period of time that is assigned, after then only they can use their mobile phone taking from that basket. So this is how we can control the digital thing in our family. Silent notification is very usually practiced here. So many of us put our phone in a silent so that we could not get disturbed in a specific time period. Now talking about the spiritual self-care. So spiritual self-care is something which is more than what we know ourselves. So this is a self-realization, this is a self-awareness that we get through the practicing spiritual care. And how it is going to help us, we can see it help us to practice gratitude and reflection, connecting to nature or spirituality, aligning action with personal values. So spiritual self-care is not only what we know. So this will help us to practice gratitude. This will help us to know the meaning of life. This will help us to know connect ourselves with the nature that is surrounding to us. Oftentimes we are not used to it, or we don't know about it, and even we don't try to get to know about it. So spiritual self-care in this way is very important. Like meaning and purpose in the things we value, and then the search for inner freedom or peace of mind, then an experience of living, flourishing, and finding hope and amidst pain or difficulties, loving relationship that we are having with self, others, and beyond, being in a present moment. So these are the spiritual domain which we will be getting by practicing this spiritual self-care. Now building emotional resilience, how we can build emotional resilience. So first thing is cultivating optimism. Most of the time we are always get in touch with the negative aspect of life. Like whenever there is incident happening with us, then our our focus will be on the negative aspect of life. So practicing the positive aspect is very important, and you can only do it when you are getting self-aware and when you are seeing the both domain of your life. If you are seeing the negative, then you must understand its positive aspect also. Then second is the learning from the challenges. As we talked about the resilience, so resilient itself is to learn from your previous experiences. This learning will help you to build or cope the upcoming situation or upcoming negative situation in a better way. Then developing a problem solving skills, how you are identifying those problems, how you are generating the alternatives of those problems, and you are practicing those problems, the alternative solutions one by one, and getting the problem solved. So this is how the emotional resilience help you in taking self-care. And also we have discussed it in detail in our last lecture, so you can go through it also. Now the importance of mindfulness. So as we talked that mindfulness is paying attention, focusing yourself into the present moment. So how it is going to help you to uh, know about yourself, your shortcomings, your positive things. So this will also help you to take your proper self care. Then reducing stress and increases focus. So mindfulness is going to help you in reducing stress and increase your focus or your attention. Then breathing exercise, body scan. So all these things are part of the mindfulness that is going to help you in grounding yourself to the surrounding and knowing yourself, your feelings, your thought, and your behaviors or your actions in a better way. Role of positive thinking. So how positive thinking can help you? So as I talked in a previous slide that it is our general way to think about a negative aspect of our life. So positive thinking help you to restructure your that negative thought process and get into the positive or a constructive domain. So practicing a positive thinking is one of the best way to that is going to help you to deal with your day to day life problems, activities. Then practicing gratitude, the because most of the time we do good things in for the society, for ourselves, but we generally we don't pay gratitude to our own self. And this self gratitude to self as well as others is very important. This help you to build a positive emotion in you, and your and this help you to regulate your mood in different kind of situation in a better way. Then visualizing success. So visualizing success is actually a full theory that is going to help you. When you are visualizing your success, your achievement, then automatic a pull will be created and you will work on that domain to achieve those things successfully. Then managing stress effectively. There are many ways that we have discussed to manage your stress. There are many coping strategies that we have discussed in, like recognizing stress trigger, working on it, using some relaxation techniques like breathing exercise, progressive muscular relaxation, JPMR. There are many strategies that you can practice, and in many other modules also you have been taught in a detailed way. So you can practice this to keep your stress free. And then time management. This is also the thing how you are prioritizing your work, which work is important for you at your current state. So by prioritizing your time and event, this will help you to take your self care in a better way. Then emotional regulation skills like you are able to identify your emotions, labeling emotions. There are many circumstances or event when it is happening, we are not able to understand in that situation why we are reacting in a negative way, and sometimes we later on we get to know that it was the reason that we did, or the act was impulsive and we feel regret about it. So practicing emotional regulation skills will help you to understand your shortcomings or your emotional disparity in that particular situation. For that, you can use stop technique or you can use rain technique. S means stop, T means take a step back, O means observe, and P means proceed. Like whenever you are in a situation where you can act impulsively, so just first thing is to stop yourself. Then take a step back means that try to get away from that situation so that you can see that situation from a different perspective, and then observe your emotions that is happening inside you. You are able to get aware of your emotions and then proceed. So this will help you to give a time, and so that you can react in that situation in a much adaptive way. In a similar way, the rain technique is that. Third thing is seeking support. So always it is very important to seek support whenever we are not able to deal that problem in effective way by using the strategies that we are having or we are practicing since long. Role of social support system, as we already discussed, that family support, peer support, friend support, institutional support, and workplace support is very important in maintaining the mental health or practicing the self care. The family, friend, professional, peer support, social connection, these all act as a protective factors. So that is why it is very important. Now there are certain crisis situation, or the situation we talk where we are not able to think, or we are forgetting what to do at this point of time. For example, in an examination center, if a person is feeling very anxious, or he or she is not able to control his or her own emotions, so that's a crisis situation where we need to understand. So crisis can be at any point of time. It can be it can happen at home, at workplace. It can be traumatic or non-traumatic. It can be stressed, very highly stressed, or moderate stress. So it can happen at any point of time. So practicing self-care while crisis is important, and for this you need to maintain your own self-help kit. You have to understand that whenever you are facing any crisis situation, then what kind of strategies is going to help you or has helped you previously. So you can maintain a kit of that technique and practice whenever these crisis situations are happening. So you can manage the trauma triggers. You can identify the triggers where that situation, or you are feeling a traumatic, or you are facing an stressful situation. So you can manage those triggers, and then limiting exposure to the distressing news. There are many news or incident that is distressing to you or acting as a triggering event. So you can manage those, or you can avoid those events to get triggered. Then practice meditation, stay active, avoid news, talk to loved ones, avoid people pleasing, and think realistically, don't panic. So this is the very common thing. Apart from this, as I told, you need to practice, you need to make your own self-care toolkit, so that you can use it whenever it is required. It can be relaxation, it can be self-soothing skills. Self-soothing means there are certain things. Someone can feel better when they have a good perfume, pocket perfume. So whenever they are anxious, they are stressed, they can use it. So other thing, you can use your other 5 senses. You can practice grounding techniques. So many things are there, and you can make as a toolkit of all these things. Now self care for a student. So for basically for a student, balancing personal life and academic life is very important to maintain boundary between those. Seeking campus mental health services. There are many facilities in every campus related to the mental health or other health services. So they can seek that in a correct time. Then time and stress management tips that we already discussed. Then self care for professionals. So for professionals, preventing burnout is very important. So if we are doing one task for a very long period of time, so it happens that people can face burnout, and within this phase, people may feel demotivated, may have some negative emotions, may lose the motivation to get the work done or to continue with that. They can have procrastination. So all these things are the part of burnout. So preventing burnout, we can practice by making time for ourselves, by enjoying lunch break in a better way. Learn to refuse, like you have to be assertive, whether if you are not able to do, or if you are not willing to do, or if you are not capable to do any problem or task, then you can refuse it assertively. Then organize your own schedule, eat home meals, cooked meals, and practice time management. Nurture relationship, find your fitness passion. So all these things will help you to prevent burnout and make the work life balance. There are many domains. Your family is different domain, your work is different domain, and your other professional activities are having also a different domain. So you have to clear the boundaries in your each sphere of life, so that you can well adjust in each domain and you may not feel burnout. The organizational support for wellness, this is another important aspect which can be seen for the professionals. There are some gender and cultural consideration. So there are two different: individualistic culture and collectivistic culture. So individualistic culture that emphasize on the personal autonomy, self fulfillment, self care, and solo activities like therapy, journaling, gym, worked out. So all these things are usually practiced in the individualistic culture. And in collectivistic culture, people view self-care through a lens of family or community. It may involve caring for loved ones, participating in group rituals, communal activities, or to improve everyone's welfare. So self-care is different in different culture. So some cultures are individualistic, some cultures are collectivistic. So in each culture we have to consider the difference and we have to accept the difference. General role and mental health stigma. General role is also a very important point to understand here. Like if we talk, then a man may delay professional visit because real men tough it out. So we will hear that men does not cry because men is seen as a strong in social aspect. So this is a kind of misconception that sometimes happen in the society. So while woman might neglect her health care to family for her family, leading to burnout and worsened mental health. So women, they feel burnout because they put the family first and them herself second, and men, they try to avoid their feelings because they are seen as a very strong entity in the society. So this is how a gender role and mental health stigma plays a role in the practicing of self-care. So for this, the inclusive self approaches are very important, in which all these things can be considered and then a strategic plan can be maintained. There are some barriers or some myths or misconceptions related to self-care. The myths can be that self-care is selfish behavior. This is one of the biggest myth. Then self-care only involves pampering yourself. Then self-care is expensive, self-care too much time. Self-care is only for the people who are struggling. Self-care is a cure for mental illness. Self-care is optional. So if you see the myth 5, mostly we think about it. When we are getting any kind of physical issues or mental issues, then only we go for the self-care. So but it is a kind of myth. Everyone can or must practice self-care, though they are healthy or they are doing well in their work. So lack of time resource is another barrier. Societal pressure to be a constant productive. This is also a kind of barrier in practicing self-care. So how to overcome these barriers? So normalizing rest, that rest is important for everyone. Care is important for everyone, whether he's child, whether he's adult or anyone. Self-care is for everyone. So rest is important, and setting a small achievement goal. Don't set a very high expectation that from first day onward you are going to do a immense exercise or you are going to run 5 kilometers. So these all will demotivate you to practice self care. You can set a small goals that you can achieve, and then slowly you can proceed whenever you are taking time. Use reminders and routines. So it is our habit that we practice by putting reminders. So reminders will help you to stay motivated, to get in touch with that self-care routine. Creating a personalized self-care plan. So don't go with the self-care strategies that are practicing. You are seeing that people are practicing. There are many YouTube channels, or there are many things that you will see in different social media. So it is not that you have to practice that as it is in your life. You have to weigh it. You have to see whether what kind of self-care plan you need in your life according to your need. So analyze your need and then start making a plan how to go for it. Goal setting, then reflect and revise. If you are not able to practice this, reduce the intensity or change as it is required. There is one example from an educational setup, a case study I would like to read for you. A second year student, Mr. A, began experiencing acute anxiety, sleeplessness and panic attack under the intense academic pressure. He reached a crisis point when these symptoms started affecting his academic performance and social life. Fortunately, Mr. A was connected to the institute counseling service through his student guide, whose role include early identification of struggling students and guiding them to a mental health resources. So with the student's guide encouragement, Mr. A assessed the counseling service, a structured initiative combining brief cognitive behavior therapy, psychoeducation, and a daily mindfulness and breathing exercises. The student guide continued to support Mr. A by checking in regularly, encouraging consistency in the sessions, and liaising with faculty to adjust the deadlines. After 4 to 6 sessions, Mr. A's panic attack ceased, sleep improved, and his concentration returned. He regained the academic confidence and began participating in a group mindfulness activities. Inspired by this progress, Mr. A has since become a peer advocate, demystifying counseling service for juniors and actively helping others assess support. So, what are the highlight of this case study? So, this case highlight the powerful impact of integrated self-care framework, early detection via student guide, accessible on the site of psychological support, psychosocial support, and structured self-care intervention. So, academic flexibility, peer-led encouragement in helping student and navigate crisis and build resilience. So, by this case study, we get that self-care is not a single person responsibility. It is for everyone. The whole community, the society, the institute, and everyone is going to take part in self-care. This is how our overall mental well-being can be maintained. These are the references that we have used in our lecture, and thank you for patient listening.